across multiple locations such
Welcome
as
to the Sundown Show. On this show, we bring you the movers and shakers of South Sudan and the world over. We engage in debates and discussions that unearth the stories behind the news. And we have our light moments too by chit-chatting about issues that affect our day-to-day life. We stay right here on the Sundown. Join in and be part of the show on iRadio, your eye on South Sudan. The Sundown. For the news, views, opinion, debates and discussions. Listen to who is who talking about issues that affect our country and continent. Only on the Sundown, your eye on South Sudan.
Hello and welcome to the Sundown Show on iRadio with me, Madrama James. In this first hour, we begin with a look at that's a non-communicable disease, or known as that's NCDs. These are illnesses that are not spread from that person to person, and they often develop slowly or over time. Globally, diseases like diabetes, cancer, heart conditions, chronic breathing problems, and mentally health issues are now the leading cause of that death and disability. Almost 3 out of every 4 deaths from this disease happen in low and middle income countries, and most of those who died are still young. Experts says the rise in that NCDs is linked to things like that poor urban planning, unhealthy diets, aging, air pollution, and weak health system that cannot detect or treat the illness early enough. Here in South Sudan, non-communicable diseases have caused about 28% of all deaths since 2022. Of these, 9% were from that heart diseases, 7 from that cancers, 2 from diabetes, 2% from that chronic breathing problems, and 8% from other conditions, including injuries. To share more light on this topic, I'm joined live in the studio by Taban Godfrey from that South Sudan Red Cross, who is the health manager at the headquarters. Then Joyce Guo, in charge of that Diabetes Center, Melekia, PHCC. Then Leila Osman, health officer, Juba branch. The South Sudan Red Cross is one of the 192 national societies worldwide and was founded on the eve of South Sudan independence in 2011. It was created through the Act of Parliament on 9th March 2012. South Sudan Red Cross is a volunteer-based humanitarian society and works as auxiliary based on that public authority in the humanitarian field. Based on the status of the International Red Cross and Red Crescent movement. Good to have all of you in the studio, and let me begin with that, Mama Joyce. What exactly qualified as an NCDs and how it is different from other infections? Welcome.
Thank you. I read you. I'm so pleasant to be in the studio today. Non-communicable disease are illness that is not communicated from one person to another. So the difference between infectious disease are caused by microbes like bacteria and virus, and they are communicated from person to person. This is the difference. They are not caused by infectious agents.
Now, to those who will be also following us, you can break out simple in that's our simple Arabic wal Arabic bita konyo de barasha nas bager faimu ayande oshino marhab.
Ana der na guleshino al amrat al mawris ma bemshi min zol le zol de abigulo NCDs lanu ma mitakhal min zol le zol. So humon de ferikto mon shino ما بيتاكل من زول لزول لأنه هم chronic and develop هم كان هم بيجين فترة طويل وهم دير يعني برنامج بعمله اللي بيعملوا بهم نظام.
نعم.
So ferric tomon لأنه أمراض تانين دي أمراض تانين دي يعني جيلغو بفيروس أو بكتيريا عشان كده تجيلغو من زول لزول لكن NCDs ولا non communicable disease ده ما جيلغو من زول لزول إنت عنده حقك وحقك بيكون معك عشان كده كلنا سبارة دي عارفه قال communicable disease والأمراض اللي بتنتقل من زول لزول ما من ديل ده اللي بيثبت فيروس وبكتيريا وديل أورجانيك أكل من زراعة ما من مصنع لأنه أكل من مصنع ديل شالو برا فوقه ألياف عربي جينا دي ألياف وإنجليز جينا دي فايبرز وديل فايبرز ولا ألياف دي جيسادو شنو هرمون إنسولين عشان دي بينزم في سكر عشان كده ألياف ما في بيك في حاجة بيقولوا تراكمي سكر راكنه كتير في الجسم دي سبب تجي لجو زول ما عنده ورثة في ده سكر يجي لجو منه سكر لأنه نجاكل حاجات قليل من الألياف عشان كده ده يجيب لنا سكري وحاسة سكري ما ورثة بستين يا ورثة الورثة دي والسنة وفي نسوان حوامل وبريشة دي حاجاتنا ما بقدر غيره لأنه هم جاء أوتوماتيك في الجسم بتاعنا.
شكرا جزيلا. نمشي برضو لتابان. Taban, what types of that laws or public measures can be put in place to combat the issues of that NCDs? Like you have heard from that Mama Joyce, there's a concern already. People are eating that unhealthy food and so forth and so on. Welcome on board.
Thank you, iRadio. Thank you, listeners of the iRadio. Yes, there are so many things we can put in place to address this non-communicable disease, especially if we take laws or policies related to consumptions of sugar. Of course, the policy of the government can be more of increasing taxes, taxing the increasing tax on sweetening beverages, taxes on smoking cigarette, maybe banning of advertising or marketing this smoking cigarette. So also policies related to public smoking should be also put in place to avoid random smoking in the public. That could address some of these NCD-related diseases.
All right. Now over to you, Leila Osman. Being the health officer at Juba branch, what are some of the great concerns your sector is receiving? For example, how many lives you are getting per day or per month or per week? Welcome.
Thank you very much, iRadio, and thank you, listeners. Thank you for hosting us today for discussing this matter about NCD. The lives that currently we are doing, we are running that project of non-communicable disease, but however, it is only in one location in the POC that is targeted. There are millions of deaths could be prevented from these non-communicable diseases. Actually, by reducing tobacco, let me say by reducing tobacco use in the country, it will be and they also unhealthy diet. It can be also air pollution, which can, if we prevent all this, then we can be able to reduce NCDs in the country, more especially in South Sudan. Yeah.
And reducing all this that you have mentioned also required cash at hand and some other resources. Now, what is the global target for that reducing NCDs and mortality by 2030?
Well, the global target for reducing NCD mortality by 2030 under, if we are on the track, we see if we're on the track here.
Okay, first you start whether we are on track or not, then you come to the target now.
Okay. Well, the Sustainable Development Goal is to reduce premature death from major NCDs by 2030. The progress has been made in some of the regions, but in South Sudan, most countries like South Sudan are not yet on the track. Yeah, especially those facing rapid risk factors, growth, and weak health system. Our health system of South Sudan is not 100% to handle the cases of communicable diseases, like more especially we have challenges in infrastructures and also the medication. Yeah.
A quick one. How would you really determine that this country is on track? What are some of the indicators or considerations?
Determine the country, South Sudan?
Yeah, for example, how would you know that South Sudan is on track or it's not proper? Yes, Taban, you can come in.
Yes, I think there are so many indicators that we can use to say that our country is on track. One is we need to have at least enough data that we can measure the prevalence of this disease. Like if we take diabetes, what is the prevalence rate of the diabetes cases in South Sudan? So we don't have adequate data that can measure this. And take example, how many patients or persons dying from this different disease. Take example, hypertension, maybe heart-related disease. So there's no clear data that can quantify that we are on track or we are not on track. So the challenge is our digital information system is not so much taken attention to, and at the same time we have the issue of ignoring this disease because it's a silent disease. People focus more on disease that is can show signs and symptoms like, say, malaria, diarrhea, pneumonia. These are easy disease that you can easily diagnose and treat. But if you take hypertension, diabetes, sometimes it can go silent until you do some checkup and then you confirm that you have this disease. So for the moment, we can measure only that if we improve in our system of reporting and capturing the data in the health facilities.
You earlier on said at the moment there are no clear data to indicate whether South Sudan is on track or not, but how does this also affect some of your intervention? Because I know South Sudan Red Cross, in some other occasion, they also come and respond to issues related to that NCDs.
Yes, of course, for South Sudan, for us to go ahead with the support, we normally do our survey. We do assessment in areas that we wanted to implement this project. Like currently, we are implementing this NCD project in a humanitarian setting. In Juba here, we are implementing previous location, POC. Because these are people who are IDP and they are in humanitarian setting, we considered, and we do assessment there, and we found that these cases are in this among the community. That's why we intend to implement this project in this location. So it's by our assessments, and at the same time we do also mini survey in the course of implementation to check whether our interventions has improved or is improving the situation in the camp or in the POC.
Before I invite, that's Mama Joyce, you say you first did the assessment and that's why you are able to intervene. But in a situation where there was no assessment, no data, how does it really affect intervention? Absence of data, how does it really affect interventions?
Of course, without data, you cannot make a decision or make a plan. You need to plan when you have a data. So the data is the one to inform your planning process. At the same time, what kind of programs or intervention you should put in place to address. So these are important information for us to use. I mean, information normally we use for making decisions and also for planning. So if there's no data, of course, it's very difficult to move ahead. You say you are implementing this intervention. That's why we have to do assessment first before we implement a project.
All right. Mama Joyce, NCDs is linked to that things like poor urban planning. And now how does air pollution stack up against that lifestyle risk like smoking or even diet?
It is really, considering our situation in South Sudan, our environment is not fine because we have a lot of pollution. Then the diet, people are not eating a balanced diet, unhealthy diet. Then the other thing is genetic. People get it through their grandfathers. It is inherited. So with the pollution, what we have to do, we have to intervene and reduce the risk of polluted area, whereby all the NGOs and governments should work in hand so that there will be a very good environment for at least to reduce the NCDs who are caused by pollution of the air.
Where are some of these pollution coming in from? Someone will say South Sudan here, we don't have a lot of industries.
Yes, we don't have a lot of industries, but South Sudan was in war. We have a lot of guns who are shot. And now, I'm telling you that pollution comes. We are not eating our original foods. The foods come from the factory, whereby things are not fine. Factory foods, they are manufactured, they are processed. The imported things are not going. That is why it pollutes your body. For example, cancer causes a certain change of cells in the body. You don't know the cause, but your cells change. Heart attack, pressure is all associated with diabetic. And I'm telling you, diabetic is real in South Sudan. Me who is working in the center, we have almost 1 year. We are going to 700 people per year or per month, which is very, 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 very dangerous. So we have to intervene in this. So with that one, because air pollution, in the report of World Health Organization, they say 10.2 million people died prematurely because of that. So it needs really intervention so that our health, our sanitation, and our food should be in a healthy way. There we prevent things. You're most welcome.
Yes, Taban, you can come on board. And
let me just add on what Mama Joyce has just said. In terms of pollution, we think the pollution is coming from industry or maybe from maybe big factory. Pollution sometimes, if we take our local, home setting, there are houses where we don't have good ventilation. Our mothers or our sister at home, they normally cook using firewood. This is already a pollution for individual at home. And then take example, in the public places, there are some vehicles that pollute and then they are not regulated. You can be on the road, but you find yourself among, you are in the, you are suffocating in the smoke. Somebody just passed by smoke is filling the whole road. That's already pollution. And there are people who smoke also in the public places and not knowing that one, his enjoyment is the danger to another colleagues. Smoke freely without any control. So these are some of the sources of pollution. Other can be maybe individually at home, somebody sweeping the compound, a lot of dust. So, of course, people think this is normal, but eventually, after some times, in long run or in lifetime, somebody start developing complication because of this kind of situation.
All right. Yes, Mama Joyce, ita bielga bedri saratana dakid baham suku yal nasku bar lekin haya madeta bielga jana sukerli sen indu sartana indu dakid bedab malu udel ba kena molushune yan bedab marhaba.
Ay kan jina fi saratana de khalayata jisim yagi gero baro fizol bar of course institution asan kida al del buogif le akela nagakulu akel nagakulu de masihi ajade kulu gijibu min masna ajal kuis fi juata hajade shilu bara le gesa do kisim wota gili go pressure de le yari sukerin kan na ruwa ligo sabab shunu ta pressure yani fi dukhuniyat fi shunu fi wari ha asan kida keli nakulu dukhuniyat alisihi ma dukhuniyat alfogo dekhin asan kida tegili go yal sukerin fogo hajade akela nagakulu de masihi de frankly it is kutuo la ano unhealthy eating
ma fizol bukem nas Bureau of Standard mon shakalin fi hukuma fi hudud wakil legad bidakal hukuma burudu kefa shanakil albatali dakal المواطنين bitu
wallahi haja de bikun yani de bureau le wogif le insan asa ana fi melekia binowari nas ma yakulu ungali ma yakulu degifina ma yakulu makorona sheria arus wa sukariyat lana ajade kulu manufactured maindu aliaf maindu fibers asan kida nagakul hajade yomian de sabab sukari jalena lano fi haja bikulu turakomi be ingilisi gina dik hemoglobin A1C sukar biga mala malian fi jisim lano aliaf ma fi algisa du shunu insulin hormone insulin tala taban hormone de biga magish takal asan kida de bitogof le akela nagakul o de bogof le environment al naga gen fogo tayno ade bogof le physiological act yani fi biology fi gisim bitak hajade tagakulu biga gamul shunu the lifestyle yajibu lena mashakil
ana biyamshi twali batshwiya le gubal da kana bi rahibu kaman guo batshwiya le kinta bielga ita lughat bonus gado ugali sukar shunu kenas makul fizol dukelem ya Mama Joyce nina khalas fi .com وفي chicken وفي pizza وجزء من حاجات القتال من شركة لزول تبقول بدبشنا
لديل أنا دير advice مون كلمة كون routine food كلمة كون everyday food itabisilu indunuzum kani atake ishtak fogo lakini alina baakulu kasan fa asida de kenna kulu whole grains na barata na seri bitana na bata no dura bitana they are quiz they into fibers obisadu gisimtana. Yes.
Okay, over to you, that's Leila Osman. What are some of the urgent intervention that need to be put in place to avert all the scaring and alarming situation you have heard from your colleague? Welcome.
Thank you. What our request from our government is to set policies so that we can end these risk factors that are related to diabetes and hypertension in the country. when policies are set, like for example, bringing in the manufactured foods to South Sudan, at least there should be measurement, like the health team can be at the checkpoints. They can be deployed there so that they can be able to restrict a lot of fortified foods to come into the country. But the best way is our intervention should be like we have to focus on agriculture. That's the best way of reducing NCD in our country.
All right. Dear listener, if in case you've just joined us, you're listening to the Sundown Show on iRadio with me, Madrama James, and I'm glad to be joined by 3X team. That's a guest from South Sudan Red Cross, and we are talking about that non-communicable diseases. If you have a question or comment, please do not hesitate to drop it via that's our Facebook page, or call us live on 0911-022-986-986. After this break, we shall come back to get your good questions.
Life is about flavor. You gotta spice things up because there's only one Benny. It's a mission to give the people more flavor because flavor is a feeling. It transforms any meal from lunches on the go to mixes, salads, and soup. You just need one envelope to bring everyone together. Benny, live with more flavor.
Welcome back from commercial break. It's high time now for you to pick that cell phone and dial our studio line on 0911-022-986-986. First caller, iRadio. iRadio.
Hello.
Ayua. iRadio.
Hello.
Ayua.
Yeah, good evening.
Good evening.
Yeah, you are connected with John and I from Wow.
Welcome. Oh. Get back to us on 0911-022-986-986. iRadio. Malaysia nina faketa akuna min wow lakini nasuma min dabaru iRadio.
Ay, Mark.
Aywa munu dar min wen.
Allah ya Madrama ay taarufana so.
Oh ya salam Ustaz Kamalia.
Ay.
Marhab.
Those who are with you, I greet them.
Shukran.
They are proportional. يعني ده الناس دكاتره. I want to take them back. كلام بتاعهم ده كله قاعد يتكلم ده. كلام ده في محله. لأنه في 40 50 60 70 انت ما بتلقى الموت بطريقه ده كله.
نعم.
ليه؟ على ان الاكل اللي كان قاعدين ياكل ده زي دكاتره ده كلام ده كلام صح. والموت ده زمان somebody from 70s 80s تغمبار ده منيا يعني هناك ثلاث اسماء في نجارة قال ده فلان كان هناك he will be more than 8 years 9 years sometimes 100 years. هسه امراض العصر ده سكري داخل وبتاع ده في الحقيقة ما في كان زمان كان قامسوا الناس اللي عندهم rich people ناس الغنيانين أفكار كتير سلوك كتير هم بتاعهم قروش يا قامسوا كمان ربنا عارف قالت عنده قروش ودي لذا سرطانة ودي now we surprised جينا صغير عنه داخل كل من أجازة داخل الكلم ده كلام اللي أنا قلت ده كله سكين ناس زي ده بروفيشنال مون بتاع ده مون بيشوف صحيح مون كلمة زي ده بيرفعوا للجفرمنت بيحللوا الموت الكتير ده حاصل من شنو to come as a recommendation or resolutions برسول الحكومة so that حكومة بعرف قال الموت الكتير ده السبب بتوع كده so that حكومة بيقدر بيشوف طريقة to stop this Hajat al-Giji min barra zai da katir kelin da sai when they are the cause of all this.
No.
So asa kadna kelin zai da mafurud biyar fa da hukuma. Then hukuma biyar mod al-katir zai da waba. Da bisamu waba zato. Al-akil al-Giji bu buta da katir kelin da waba. زي كوليرا ومرض بتاع جرود بالضبط there is no very زي ده so انا الكلام ده المفروض تمشي يرفعوا لحكومه كلجنه طبيه وانالايز بالضبط الموضه كتير سبب بيساوي كده وسبب ده في تاني وانا ما اسمع هو بعد ما رتب كنا يعني مقاومه في الجسم داخل ما في جسم داخل الوايت سيلز بلاد ده ما شغال فلو دي ليس دواء ويتجاب ما بيشتغل تبي متواضع اي because دواء without action you go to a week تبي متواضع this is one of the reasons كمان انا الناس كل جانين
شكرا جزيلا. ده كان أستاذ كمالنا في جوبا وبرو تباقدر شيل تلفون واتصل معنا 12 في 09 وايد ولا 22 986 ناسما من ديت ولا اي راديو ايوه مساء النور. منو در من وين؟
معك إيمان لونبابي في يامبيو.
مرحبا ما
أنا كان در أصاب ديف ده كل جبل في أيانا de enselezol ma ben stan gidam bitala kan koroni kama ben gidam fi kalam zana smeti kida gizel yala badako gol kaman akola jate bisa mashini ya bigi zol alfa ayat ya ma enselezol gidam kede won salana tamam kida lan kalam de kan ge foto adan tait kida yani kede won salana tamam sanasma.
اوكي شكرا جزيلا. احيانا الكرونيك ما بيمشي لقدام وهل معقولات بتاع الشركه برضو بقدر جيب عيان كيف. نودي فرصه اول لماما جويس عشان يفاصل بعربي يلا بعدك انا بودي فرصه كمان لكم عشان نتصل تاني في 09 وايد ولا 22 986 مرحبا ماما جويس.
نشكر إما أنا جبر قلت في أمراض الما بورثوا الما بينتقل من زول لزول وأمراض ده حلقاتي وأمراض القلب في القلب هناك تبلغوا في الداخل وفي هارت أتاك يعني في سقطة في القلب وفي ستروك اللي بيقولوا زلتا يلا تبلغوا في حاجة بيقولوا كانسر على سرطان وتبلغوا يعني في حاجة بيقولوا يعني مشكلة في التنفس اللي أزمة وتبلغوا سكري وتبلغوا في مشكلة في منتال يعني في مخ في حياتك ديل أمراض اللي ما جوريسو ولا ما جورا لزول جيجو بدو زول وما برا قدام في أمراض تانيين خلايات في جسم يجي جيرو إنت ما بعرفه سبب شنو وفي أمراض تانيين اللي نجا كل أكل البطال زي سكري ده زي جبر أمم بتاعنا كلم زمان في سبعينات في خمسينات في ثمانينات ناس جا كل أكل صحي سكر ما في لكن هسه نجا كل حاجات بتمسنا سكر بيجا ديب يا زول جنا سكر زول كبير وياتو سنة بيجا كل عنده سكري الحمد لله في يامبيو كليتا كروزو راسو لنا أكل الجي كروجو من مالزارة ده أكل صحي لكن بتمسنا ده عنده مشكلة لأنه في حاجات كتير تاني شيلو برا عشان كده ده سبب كبير قالوا في أمراض الماء جت تخل لزول وسبب تو أكل كان في أكلات اللي جبتها جونسو ده لأنه أكل ده جزاله من مسنا حاجات الكويس ده شيلو برا ده سبب تجيلو قال لحد إنها حاسة في حاجة بيقولوا فيتامين بي 12 يزول عنده وجه في ركبه ما في فاكل لنا قاكله عشان كده جيت اقول قال لي ده رطوبه ولا قال لي ده شنو يا حاجه كله بطال جسم تاع الناس كله وجه عشان كده ده سبب بيقولوا كده
Now, Shukran. Via our Facebook page, we have Joseph Lokak Charles that the public needs to be sensitized about the risk factor for that NCDs. Lifestyle has changed with increased urbanization in advanced countries. NCDs is part and partial of that planning system. Example, planning our roads need to consider that the spaces for walking. What's your take on that, Ataban? What's your reaction on what Joseph wrote that via our Facebook page? Welcome.
Thank you. Can you repeat the...
Joseph gave an example that in some other countries, NCDs, that's non-communicable diseases, is part and partial of that planning system. For example, if they want to plan road, it's in the system of the government, but sometimes here it's not happening. So what's your reaction?
Thank you, Joseph, for asking this question. Our government has all the plans that support the NCD. All that the priorities, we have so competing priorities in the country. As I said, NCD is a part of the government plan, and if you say our disease surveillance or the disease that are put under the category of surveillance, NCD is also part of that in the list of that diseases. So government has not neglected all that the competing priorities of the disease has been put in forward, taken care of. Because NCD is chronic, is not transmitted from one person to another, it takes time for somebody even to detect. Maybe in future this may be something we can advocate for government to increase the budget in health system so that NCD can be addressed. Currently, if you see the government budget allocated to health is limited, it's not enough to support some of the diseases which are not priorities. So that's why the little budget that goes to the health is more of supporting the priority disease, mostly the communicable diseases. So it is in the plan all that the priority has to be taken care of.
Thank you. Still a chance for you to call us right here on 0911-22986-986. I read you.
Yes, I read you.
Yes.
Yes, I'm getting you clear. I'm called Charles from Mangala.
Charles from Mangala, good to have you.
Yes, I really wanted to say something about the guest. I'm so pleased to hear about interventions on how to curtail these
non-communicable diseases.
And then through agriculture, I think we can curtail those, because when we look into those foods that had been processed and consumed are the factors to those communicable disease. And then again, what I can say from the government, sometimes the Ministry of Agriculture do advocate people to go and do agriculture, but when you go to get some help from them, there is nothing. So I will really want...
What kind of help are you talking of?
To help the farmers, giving them some other agricultural tools and even seeds, so that they can be able to produce those natural foods to help the community from this non-communicable disease. So I myself am a farmer, but one time I met the Ministry of Agriculture and I wanted really the help for my people, but again there is nothing. The government has no capacity to help the farmers. So it is that time for me to talk to the guys in the studio to advocate and even to make a network for the farmers with the NGOs so that they have that information into how they can access those interventions from the government and even the NGOs. So
thank you.
Yeah.
Well, that was Charles from Mangala. What is your reaction, Leila Osman, on what that Charles just said? What do you have to say?
Well, Charles, thank you for reaching us. Your point of saying the government have to support the farmers with tools. It's right, but however, currently we have to talk about individual interventions within our households as well to prevent the non-communicable diseases. Of course, the government, as what Taban has made clearly, every budget is there. Budget for agriculture is there, and for even health centers are there. But the problem is the budget maybe the government will be having, it won't reach, and it won't satisfy the community of South Sudan generally, because of other challenges maybe the government will be facing. However, what I will recommend is that the government can also put in laws resources, focusing on cost-effective interventions such as tobacco control and support for healthy diets. And also physical exercise, that is not from the government, of course. Physical exercise, it is our own responsibility as individuals of South Sudan. And also we can offer a high return on investment in the individuals of the countries. Yeah, so, and also integrating non-communicable disease screening and care into existing health systems to help us to detect earlier detection of the non-communicable disease. If these policies these measures are put in place within the health facility, it can also help, so that we see. It can also help the community, like someone may come to the health facility with a different case, but if we have free screening at the health facility, and then we can be able to detect it earlier and then to reduce the cost. Yes.
Thank you very much, Leila Osman. 091122986986 لين سؤال ولا تعليق لضيوف بتاعي في داخل الاستوديو قدمته على راديو.
مدرمة؟
ايوه
انا نسيت جويل شوية حاجة تانية.
ده شنو يا استاذ كمال؟
بعد ما نعرف الامراض ده what is the way forward to rescue the population بتاعنا ده. na lasa luonu زي في راديو وقلنا ده na مجبورين عشان ناكل اكل البطال بيجي بعينات ده. What is our mission and our vision for the coming generation? كان ناسر اليونس ده اكلات ده في جسم ده نسال الدكاتره هناك ده هم بياكلوا بسمت يعني ماشيين ناس ميتين. أنا عايز أقول إن كمدرسين في field of education we teach children to the time which will not be our time. So by saying this, now these are not affected. Tell us what about the coming generation? What can we do to stop this?
شكرا جزيلا.
أنا كحكومة كشعب we bring peace. So that this country, nas bizarau, iyal al naguelo do, iyal al naguelo do, go akhil al fresh, al nabraja fi zaman bita 40 o 50 al nasu ayanat da bukun mafi. Lakin when talking like this, you can do nothing. Yezo zangolo moya gurma deno glut. Ita biku moya mizasita ladi zazita gurma mavi mala.
شكرا جزيلا. أنا نودي فرصة دي بذبل ماما جويس تبقول شنو في بس دقيقة بسيط في حاجة أستاذ كمال بقول. مرحبا.
نشكر أستاذ. حاجة لنا دير هنحن هنعمله هيا فرديا سكسي ولي في مجتمع ولي في حكومة لازم نخرجوا. زراعة دي أهم شيء لأنه أكل من زراعة هو مفيد وعنده إيه غذاء. زراعة يا مهم. يلا أنا بعمل رياضة لأنه أسيد نما جريات نقاكل وانا جنوم عشان كده أجد كل جال أنا رياضة ما في وانا قاكل أكل المسيح عشان كده نتيجته لازم نخرجوا. زراعة يا مهم في كل حاجة والزراعة ده يسولف كل برنامج في الجسم بتاعنا لأن نباكل أكل سي نباكل فواكه نباكل سلطة ونباكل أسيدة من حاجات اللي نخرجوا وده بيكون مفيد علينا. وانا در أستاذ يدرس ويال يمسك خرجوا عشان من باكل أكل سي.
No. Taban in some other countries, people visit health centers not because they are feeling unwell, but they take that responsibility to know like what's happening in their body. Now in our situation, the health system is not up to the standard, no data, and some of the infrastructures are not also in place in some other locations, and also poverty. And now in such a situation, how best can someone, of course, plan for his or her health ways?
Thank you. I think for us in South Sudan, of course, we know everyone is poor. We need to start changing our lifestyle. When we are changing lifestyle, one is like Mama Joyce have just said, we have to eat healthy food. What do we mean by eating healthy food? We mean the food we eat should be more of natural food, not processed food. We should reduce the content of the processed food. And then number two, we should eat food, we call it the healthy plate food. Healthy plate food, the composition of the healthy plate food. A quarter, the food should be more of carbohydrate. A quarter should be protein. And then a half of the plates should be fruits and vegetable. That makes the healthy plate food. And since we don't have infrastructures and other like drugs that can support this, of course, our objectives here is to reduce the burden of this disease in the country. Of course, at the same time, the impact or the complications of this disease can be minimized by being active, doing exercise, eating healthy food, avoid harmful consumptions of alcohol. If possible, stop smoking. And these are some of the things that we can prevent. And also we need to do regular checkup. If you can have time, you need to do checkup to some of your health so that when it is earlier detected and then earlier intervention can be provided, you have high chance of living. We are saying, we are not saying that people should not die. People can die one time life, but we are here saying we prevent premature death. Premature death, if you die below 70 years, meaning it's a premature death. So people lifespans should be extended and people should live productive life to support the family, to support the country economy.
All right. Thank you. We are almost coming to the end of our conversation. Now we have Ustaz Sabri Joseph Elias that we are able to put an end to that non-communicable diseases through investing in agriculture sectors in order to raise up our natural foods instead of that processed one. And the government also have to support the agricultural sectors and educate people on the importance of that agriculture and improve the road network. Thank you so much, Ustaz Sabri. Then we have Joseph Luca Charles, that mosque at risk age group include that's from 40 years and above, 40 years and above, hence youth educating the public about that NCDs modifies risk factor. Thank you. And then we have Margaret that thank you for this important discussion. My question is, what step is the South Sudan Red Cross taking to raise awareness and improve that early detection of diseases like diabetes, cancer, especially in rural areas where access to health care is limited? Now, let me give that question to Taban. What is really South Sudan Red Cross doing to raise awareness and improve earlier detection of that, the diseases, plus your final remark for today as we are coming to the end of our conversation. Welcome.
Thank you. South Sudan Red Cross has already taken a step. As we talk, we are already creating awareness. We are here to create awareness to the public to understand there is a disease, we call it NCD, that is ongoing. And we have started piloting this project in Juba, POC. We are targeting humanitarian context, especially those in IDP, people who are refugees. So this is a pilot project we started because these are vulnerable group, people who are high risk, and they are vulnerable because they cannot access some of this service. So that's why we started piloting. And of course, the way forward, we after the end of the project, we are going to evaluate whether the implementations work well or not, and then for us to escalate to other locations, it will be informed by the evaluation of the project.
Thank you.
So we shall continue to advocate for more projects on this NCD project. So my way forward, my general message to the public is we have to eat healthy food. We have to, because NCD is more of lifestyle. As we mentioned, if we can avoid harmful consumption of alcohol, smoking, and then being active, is enough for you to keep yourself healthy, and a regular checkup of your health status so that you know you can detect diseases that are silent and early treatment.
Thank you. All right, over to you. That's Leila Osman in 30 seconds. What's your final remarks? Welcome.
My final remarks to the listeners, NCDs are preventable through lifestyle change, and also policy interventions are necessary to create a healthier environment.
All right. Thank you very much. Over to you, Mama Joyce, في 30 ثانية رسالتك شنو للناس القاعد بيه أسمعتها؟
رسالة بتاعي حاليتها في كتورة. الناس اللي في كتورة وناس اللي عنده عيانات في أسرة، وزول اللي ما بعملوا رياضة، وزول اللي بياكل حاجات المسيحي، وزول اللي سمين. حاليتها في كتورة. يلا في عراد بيتو warning signs كليتا عارفوا أسانتا بيجرى في مركز وشنو بولو توالي وإتا بيكون ما عنده تحا وجوزي نتاكي جينزي وتغاسر بمويو كتير زول كان عنده حاجات ده توالي كلي جرى في مركز.
نعم. لأني وصلنا توالي في نهاية بتاع برنامج وانا بشكر تابان جويس والليلة وسط زمن بتاعكم وكمان انتم مستمعين على السؤال الحجيب ديل كمان ربنا يكون معكم.